Parasitic worms are a risk factor affecting many people in various countries, especially those where poor sanitation is a prevailing issue. In this video, we will look at one worm that is pretty common, oftentimes affecting children. This is no other than Ascaris lumbricoides. These worms are also known as giant roundworms. Its specific name Lumbricoides is derived from lumbricus in Latin due to the resemblance with earthworms. To start off, a quick general description. These worms belong to a class of organisms known as helminths. They are multicellular organisms, they are bilaterally symmetrical, they have separate sexes, the females being generally larger than the males, and they most definitely cause harm. Okay, now we can specifically begin to talk about Ascaris lumbricoides. These worms cause a disease known as ascariasis, which is manifested by the presence of these giant roundworms in the small intestines of the infected person. Morphology. As earlier mentioned, these worms exist as males and females. The females grow up to 20 to 40 centimeters, whilst the males take up about 15 to 30 centimeters. For color, they have a pink to creamy look to them. The female has straightened posterior ends as can be seen, whilst the male has got ends that are curved. The males also have two spicules that aid in sexual reproduction. Whilst you're talking about reproduction, the female worms produce eggs that will lead to infection once fertilized. These eggs contain a developing embryo that will fully develop when ingested by a human. The fertilized egg has a round to oval shape, a golden brown color, and a thick shell. The unfertilized eggs are slightly larger, having a more elongated appearance, but will not cause infection once ingested. An important thing to note, development from eggs to adult worms takes place in different larval stages. Life cycle. Okay, let's start by looking at infection. Infection is by ingesting the infective or fertilized eggs containing the second larval stage, or L2 forms. This could be by eating contaminated food, drinking contaminated water, or even just licking or sucking your fingers after exposure to these eggs. All in all, infection is via the oral route. In the small intestinal area, the infective eggs hatch, releasing the L2 forms that invade the intestinal mucosa. Here they enter the portal and systemic circulation, where they enter the liver, the heart, and finally lodge in the lungs. In the lungs, the L2 forms undergo further development and maturity to the third larva forms, or L3. This takes place within 9 to 15 days. After this development, L3 forms now penetrate the alveolar wall and ascend up the bronchial tree. They reach the throat and are swallowed back to the intestine, where they develop into the L4 forms and then the adult worms. This is within 2 to 3 months. Here copulation takes place that will lead to the production of eggs. Some female worms produce about 200,000 eggs per day that are deposited in stool. Fertilized eggs become fertile within 18 days and will repeat this cycle once ingested by another human. Diseases. Okay, throughout the life cycle of these worms in the human body, we have seen them carry out development in two main regions, the lungs and the intestines. The lungs. Development of larvae in lungs causes Ascaris pneumonitis. This is characterized by a low-grade fever, coughs, blood in sputum, dyspnea, which is difficulty in breathing, and other asthma-like symptoms. When there are large numbers of larva forms in the lungs, it arises in allergic reactions that manifest in a clinical condition known as Loeffler syndrome. This syndrome is marked by a high eosinophil count due to the nature of eosinophils in such conditions. In the intestines. Here there is a presence of adult worms lodging in the lumen of the small intestine. The presence of a few adult worms here usually doesn't show any symptoms. However, when there are large numbers here, the symptoms easily manifest. The symptoms include a loss of appetite, impaired carbohydrate absorption, impaired fat absorption leading to steatorrhea, which is fat in stool, abdominal pains, intestinal obstruction, intestinal perforations, malnutrition and growth retardation, especially in kids. In this video, we can see the worms being surgically removed from the intestine. Extra-intestinal effect of these worms. Apart from just the lungs and the intestines, air lumbricoids will cause other issues due to their movement. These issues include liver abscesses, serious complications to the brain and heart, pancreatitis, and appendicitis. Diagnosis: direct microscopy of stool to view the eggs, direct visual demonstration of worms in cases where they exit the body, chest radiographs in such cases as Loeffler's syndrome. Treatment: drugs of choice. Albendazole. A single dose of albendazole, 400 mg for 2 years and above, and 200 mg for 12 to 24 months. Mebendazole, 100 mg for 3 days or 500 mg for a single dose. When there's complete obstruction, this will need surgical intervention. Prevention. Like most parasitic infections, these worms can be prevented by good sanitation and hygiene. Issues to do with washing your hands, properly handling food, drinking clean and treated water, and the list goes on and on. Thank you for watching this video. Please like and share it and subscribe to the channel. For any future videos you would like to see, leave a comment down below. Peace.